Chapter 5 in Fundamentals, Homeostasis, Adaptation, and Stress. Learning objectives. Explain homeostasis and list categories of stressors that affect homeostasis. Identify two beliefs about the body and mind based on the concept of holism. Identify the purpose of adaptation and two possible outcomes of unsuccessful adaptation. Trace the structures through which adaptive responses take place. Differentiate between sympathetic and parasympathetic adaptive responses. Define stress and list factors that affect the stress response. Discuss the 3 stages and consequences of the general adaptation syndrome. Name 3 levels of prevention that apply to reducing or managing stress-related disorders. Explain psychological adaptation and 2 possible outcomes. Describe the nursing activities helpful to the care of clients prone to stress and approaches for preventing, reducing, or eliminating a stress response. Homeostasis. Health is a tenuous state. To sustain it, the body continuously adapts to stressors, changes with the potential to disturb equilibrium. As long as stressors are minor, the body's responses are negligible and generally unnoticed. When stressors are intense or numerous, efforts to restore balance may cause uncomfortable signs and symptoms. With prolonged stress, related disorders and even death may occur. Homeostasis is a relatively stable state of physiologic equilibrium. It literally means staying the same. Although it sounds contradictory, staying the same requires constant physiologic activity. The body maintains constancy by adjusting and readjusting in response to changes in the internal and external environment that foster disequilibrium. Holism. Although homeostasis is associated primarily with a person's physical status, emotional, social, and spiritual components also affect it. As discussed in Chapter 4, holism implies that entities in these areas contribute to the whole of a person. Based on the principles of holism, stressors may be physiologic, psychological, social, or spiritual. Holism is the foundation of 2 commonly held beliefs. 1, both the mind and body directly influence humans, and 2, the relationship between the mind and body can potentially sustain health as well as cause illness. Consequently, it is helpful to understand how the mind perceives information and makes adaptive responses. Both physical and psychological mechanisms of perception and adaptation are discussed. Stressors. Stressors are changes with the potential to disturb equilibrium. Types are physiologic, psychological, social, and spiritual. Common stressors. Physiologic stressors, such as prematurity, aging, injury, infection, malnutrition, obesity, surgery, pain, fever, fatigue, and pollution. Psychological stressors, fear, powerlessness, jealousy, rivalry, bitterness, hatred, insecurity. Social stressors, gender, racial, age discrimination, isolation, abandonment, poverty, conflict in relationships, political instability, denial of human rights, threats to safety, illiteracy, and infertility. Spiritual stressors are guilt, doubt, hopelessness, conflict in values, pressure to join, abandon, or change religions, and religious discrimination. Adaptation. The response of an organism to change requires the use of self-protective properties and mechanisms for regulating homeostasis. Neurotransmitters mediate homeostatic adaptive responses by coordinating functions of the central nervous system and the autonomic nervous system and the endocrine nervous system. Structures that mediate adaptive response. Neurotransmitters are chemical messengers synthesized in the neurons that allow communication across the synaptic cleft between neurons, subsequently affecting thinking, behavior, and bodily functions. When released, neurotransmitters temporarily bind to receptor sites on the postsynaptic neuron and transmit their information. After this is accomplished, the neurotransmitter is broken down and recaptured for later use or weakened. Common neurotransmitters include serotonin, dopamine, epinephrine, norepinephrine, also called adrenaline or noradrenaline, acetylcholine, gamma aminobutyric acid, which is also known as GABA, capital G-A-B-A, and glutamate. Other chemical messengers called neuropeptides are actually types of neuromodulators. They help neurons communicate with each other. Neuropeptides include substance P, endorphins, enkephalins, and other neurohormones. Is the following statement true or false? Norepinephrine stabilizes mood, induces sleep, and regulates temperature. The answer is false. Norepinephrine heightens arousal and increases energy. Serotonin stabilizes mood, induces sleep, and regulates temperature. Epinephrine and norepinephrine heighten arousal and increase energy. Acetylcholine and dopamine promote coordinated movement. GABA inhibits the excitatory neurotransmitters such as epinephrine, norepinephrine, and dopamine, which are classified as catecholamines. Substance P transmits the pain sensation, whereas endorphins and enkephalins interrupt the transmission of substance P and promote a sense of well-being. Different brain areas contain different neurons that contain specific neurotransmitters. Receptors for these chemical messengers are found throughout the central nervous system, the endocrine and immune system, suggesting a highly integrated communication system, sometimes referred to as the hypothalamus pituitary adrenal axis, which is abbreviated HPA. The central nervous system is composed of the brain and the spinal cord. The brain is divided into the cortex and the structures that make up the subcortex. The cortex is considered the higher functioning portion of the brain. It enables people to think abstractly, use and understand language, accumulate and store memories, and make decisions about information received. The cortex also influences other primitive areas of the brain located in the subcortex. The subcortex consists of the structures in the midbrain and brainstem. The midbrain, which lies between the cortex and the brainstem, includes the basal ganglia, the thalamus, and hypothalamus. The brainstem, so named because it resembles a stalk, contains the cerebellum, the medulla, and the pons. The subcortical structures are primarily responsible for regulating and maintaining physiologic activities that promote survival. Examples include regulation of breathing, heart contraction, blood pressure, body temperature, sleep, appetite, and stimulation and inhibition of hormone production. Reticular activating system, RAS, an area of the brain through which a network of nerves pass, is the communication link between the body and the mind. Information about a person's internal and external environment is funneled through the RAS to the cortex on both a conscious and an unconscious level. The cortex processes the information and generates behavioral and physiologic responses through activation by the hypothalamus. The hypothalamus, in turn, influences the autonomic nervous system and endocrine functions. Activity in the RAS is affected by inhibitory neurotransmitters such as GABA and excitatory neurotransmitters such as norepinephrine. Drugs such as alcohol, narcotic analgesics, and tranquilizers decrease brain activity and induce sleep by stimulating or increasing GABA. Drugs such as caffeine, medications for attention deficit disorder, and illegal substances like methamphetamine increase RAS activity, alertness, and the thinking activity of the cortex by stimulating receptors for norepinephrine. Self-medication with alcohol or other sedative drugs of abuse, such as narcotic analgesics and tranquilizers, may decrease arousal and produce relaxation temporarily. However, excessive or chronic substance abuse can lead to physical impairment, drug dependence, and legal problems, creating more stressors than those for which they were originally intended to relieve. Autonomic nervous system. The autonomic nervous system is composed of peripheral nerves affecting physiologic functions that are largely automatic and beyond voluntary control. It is subdivided into the sympathetic and parasympathetic nervous systems. Both the sympathetic and parasympathetic divisions supply organs throughout the body with nerve pathways. Each division takes a turn being functionally dominant depending on the appropriate physiologic response. For example, when increased heart rate is needed, the sympathetic division dominates. When heart rate needs to be slowed, the parasympathetic division takes over. Sympathetic nervous system. When a situation occurs that the mind perceives as dangerous, the sympathetic nervous system prepares the body for a flight or fight response. It accelerates the physiologic functions that ensure survival through enhanced strength or rapid escape. The person becomes active, aroused, and emotionally charged. Parasympathetic nervous system. The parasympathetic nervous system restores equilibrium after danger is no longer apparent. It does so by inhibiting the physiologic stimulation created by its counterpart, the sympathetic nervous system. The parasympathetic nervous system, however, does not produce an opposite reaction for every sympathetic effect. For this reason, some believe that the parasympathetic nervous system offers an alternate but equally effective mechanism for responding to threats from the internal or external environment. For example, physiologic deceleration produced by the parasympathetic nervous system has been linked to the manner in which opossums and other animals play dead when they sense that predators are stalking them. Simulating the appearance of death often causes the predator to leave the animal alone, thus saving its life. Therefore, it has been proposed that humans too may respond to stimuli not only by speeding physiologic responses, but also by slowing them down. Some refer to this as the freeze response. So, target structures such as the iris of the eye, sympathetic effect would be dilation of the pupils, parasympathetic would be constriction of the pupils. Sweat glands for sympathetic would be increased perspiration, parasympathetic effect none. Salivary glands would be inhibited salivation, and parasympathetic is increased salivation. Digestive glands inhibited secretions for sympathetic and stimulated secretions for parasympathetic. Heart increased rate and force of contraction with sympathetic, decreased rate and force of contraction with parasympathetic. Blood vessels in the skin constricted, causing pale appearance with a sympathetic effect, dilated, causing blush or flushed appearance with a parasympathetic effect. Skeletal muscles, they would be increased in tone with a sympathetic effect. Parasympathetic effect would be decreased tone. Bronchial muscles, you'd have relaxed bronchodilation with sympathetic effect, and you'd have contracted bronchoconstriction with parasympathetic effect. Digestive motility or peristalsis is decreased with sympathetic effects and increased with parasympathetics. Digestive motility or peristalsis, again, decreased with sympathetic effects or hormones and increased with parasympathetic messages. Kidney would be decreased filtration with the sympathetic system and no changes with the parasympathetic stimulation. Bladder muscle or detrusor is inhibited or suppressed urination with sympathetic stimulation. With parasympathetic stimulation, the body would have the urge to urinate. The bladder muscle, I just did that one. Liver, you'd have the release of glucose with the sympathetic messages and hormones, and you'd have no response with the parasympathetic effect. Adrenal medulla, you'd have a stimulated effect on the adrenal medulla with sympathetic and no effect with parasympathetic. Endocrine system. The autonomic nervous system provides the initial and immediate response to a perceived threat through either sympathetic or parasympathetic pathways. The endocrine system is a group of glands found throughout the body that produce hormones that sustain the response. Hormones are chemicals produced in one part of the body, the actions of which have physiologic effects on target cells elsewhere. The neuroendocrine control. The pituitary gland, located in the brain, is considered the master gland, producing hormones that influence other endocrine glands. The pituitary gland is connected to the hypothalamus, a subcortical structure, through both vascular connections and nerve endings. For a pituitary function to occur, the cortex first stimulates the hypothalamus, which then activates the pituitary gland. Feedback loop. A feedback loop is the mechanism for controlling hormone production. Feedback can be negative or positive. Most hormones are secreted in response to negative feedback. When a hormone level decreases, the releasing gland is stimulated. In positive feedback, the opposite occurs, keeping concentrations of hormones within a stable range at all times. Homeostasis is maintained when hormones are released as needed or inhibited when adequate. In dangerous situations, sympathetic response prepares body for fight or flight and accelerates physiologic functions that ensure survival. In parasympathetic response, restores equilibrium after danger is no longer perceived. It inhibits physiologic stimulation created by sympathetic responses. Is the following statement true or false? The sympathetic response restores equilibrium after danger is no longer perceived. The answer is false. The sympathetic response prepares body for fight or flight and accelerates physiologic functions that ensure survival. Stress. As long as demands on the central nervous system, autonomic nervous, and endocrine systems are within adaptive capacity, the body maintains homeostasis. When internal or external changes overwhelm homeostatic adaptation, stress results. Stress is the physiologic and behavioral responses to disequilibrium. It has physical, emotional, and cognitive effects. On this slide, stress refers to an event or demand made on the individual or family that causes the individual or family to appraise the event or demand for the scope and meaning and to determine whether resources for its management are exceeded and whether the event or demand is neutral, no stress, or challenging or threatening. The appraisal determines the end result or outcome of healthy or disability or dysfunction. Although all humans have the capacity to adapt to stress. Not everyone responds to similar stresses exactly the same. Differences vary according to the intensity of the stressor, the number of stressors, the duration of the stressor, physical health status, life experiences, coping strategies, social support, personal beliefs, attitudes, and values. Because of unique differences, outcomes may be adaptive or maladaptive, depending on each person's response. Some stress-prone individuals have a tendency to catastrophize, choosing to focus on all the potentially negative outcomes that may result from stressors, thus perpetuating and intensifying their response to stress. In other words, they see their cup as half empty rather than half full. Stress is the physiologic and behavioral responses to disequilibrium caused by physical, physiologic, or emotional, internal or external changes that disrupt homeostasis. And it has physical, emotional, and cognitive effects. Factors that affect response to stress are the intensity, number, and duration of stressors, the physical health status, the life experiences, coping strategies, social support, personal beliefs, attitudes, and values. Common signs and symptoms of stress. Physical: rapid heart rate, rapid breathing, increased blood pressure, difficulty falling asleep or excessive sleep, loss of appetite or excessive eating, stiff muscles, hyperactivity or inactivity, dry mouth, constipation or diarrhea, and lack of interest in sex. Emotional effects or signs and symptoms of stress are irritability, angry outbursts, hypercritical, verbal abuse, withdrawal, and depression. And cognitive response to stress could be impaired attention and concentration, forgetfulness, preoccupation, and poor judgment. Physiologic stress response. Hans Selye, Selye, a Canadian physician who lived in the early 1900s, devoted much of his life to researching the collective physiologic processes of the stress response, which he called the general adaptation syndrome. Selye observed that this syndrome occurs repeatedly and consistently, regardless of the nature of the stressor. He maintained that 1, the body's physical response is always the same, and 2, it follows a 1, 2, or 3-stage pattern: alarm stage, stage of resistance, and in some cases, stage of exhaustion. The first 2 stages parallel the adaptation processes of maintaining homeostasis. So again, the first 2 stages was alarm stage and stage of resistance. Therefore, brief stress responses generally have adaptive outcomes with restoration of equilibrium. If the stage of resistance is prolonged, however, the process can become maladaptive and pathologic. It can lead to stress-related disorders and, in some cases, death. Stages of the general adaptation syndrome. The alarm stage is immediate. It's an adaptive response to mobilize via the autonomic nervous system. If the stressor is not controlled, it goes to resistance stage, which is a secondary defense that are activated via the endocrine system. If the stressor continues, there's a stage of exhaustion, adaptation is unsuccessful, and death ensues. The alarm stage is the immediate physiologic response to a stressor. At its onset, storage vesicles within sympathetic nervous system neurons rapidly release norepinephrine. Shortly thereafter, the adrenal glands secrete additional norepinephrine and epinephrine. These stimulating neurotransmitters and neurohormones prepare the person for a fight or flight response, that is, overcome the danger it represents or flee from the stressor to escape its threat. Almost at the same time, there is a hypothalamic pituitary adrenal cascade of hormones. The hypothalamus releases corticotropin releasing factor, abbreviated CRF, which triggers the pituitary gland to secrete adenocorticotropic hormones called ACTH. The result is the release of cortisol, a stress hormone, from the adrenal cortex. Cortisol plays various important roles in responding to a stressor, such as raising blood glucose and inhibiting insulin to meet increased energy requirements. Prolonged elevation of norepinephrine, epinephrine, and cortisol levels, however, can predispose clients to stress-related disorders. The stage of resistance is the second phase in the general adaptation syndrome is characterized by physiologic changes designed to restore homeostasis. Neuroendocrine hormones, although temporarily excessive, endeavor to compensate for the physiological changes of the alarm stage. If stress is protracted, in other words, prolonged, however, resistant efforts remain activated. Consequently, one or more organs or physiologic processes may eventually lead to an increased vulnerability for stress-related disorders or progression to the stage of exhaustion. Stage of exhaustion is the last phase in the general adaptation syndrome. It occurs when one or more adaptive or resistive mechanisms are no longer able to protect the person experiencing a stressor. Once beneficial mechanisms now become destructive. For example, a prolonged level of cortisol leads to higher than normal blood sugar levels and a lowered immune response. As a result, there are reduced natural killer cells, which attack viruses and cancer cells, and decreased secretory immunoglobulin A, an antibody involved in immune defense. These changes put the person at risk for frequent or severe infections or cancer. As resistance dwindles, there is physical and mental deterioration, illness, and death. Is the following statement true or false? The alarm stage is the last stage according to the general adaptation syndrome. Your answer should be false. The alarm stage is the first stage according to the general adaptation syndrome. Psychological stress response. Just as stress requires adaptation from the body, stress also affects the psyche or mind. The mind, in turn, mounts additional defenses. Coping mechanisms. Sigmund Freud, 1856 to 1939, posited that humans use coping mechanisms, unconscious tactics to defend the psyche, to prevent their ego or reality base from feeling inadequate. These manipulations of reality act as a psychological first aid, allowing people to temporarily avoid the emotional effects of stress. When appropriate and moderate, coping mechanisms enable people to maintain their mental equilibrium. Coping mechanisms that are overused or overextended may have maladaptive effects, distorting reality to such an extent that the person fails to recognize and correct his or her weaknesses. Consequently, the person may avoid taking responsibility for solving personal problems. Coping strategies, stress reduction activities selected consciously, help people to deal with the stress-provoking events or situations. They can be therapeutic and non-therapeutic. Therapeutic coping strategies usually help the person to acquire insight, gain confidence to confront reality, and develop emotional maturity. Examples include seeking professional assistance in a crisis, using problem solving techniques, demonstrating assertive behavior, practicing progressive relaxation, and turning to a comforting person or higher power. Maladaptation results when people use non therapeutic coping strategies such as mind and mood altering substances, hostility and aggression, excessive sleep, avoidance of conflict, and abandonment of social activities. Negative coping strategies may provide immediate temporary relief from a stressor, but they may eventually cause problems when used long term. Gerontologic considerations. Coping strategies of older adults are likely to focus on accepting limitations, adjusting expectations, and maintaining quality of life. Therapeutic coping strategies focus on helping the client gain insight and confidence to deal with stressors. They are not synonymous with the client going into therapy. Coping mechanisms. Repression is forgetting about the stressor. Example is removing the experience of being sexually abused from conscious memory. Suppression, purposefully avoiding thinking about a stressor. Resolving to sleep on a problem or turn the problem over to a higher power, such as God. Denial, rejecting information, refusing to believe something like a life-threatening diagnosis. Rationalization, relieving oneself of personal accountability by attributing responsibility to someone or something else. Example, blaming failure on a test to the manner in which the test was constructed. Displacement, taking anger out on something or someone else who is less likely to retaliate, such as kicking the wastebasket after being reprimanded by the boss. Regression, behaving in a manner that is characteristic of a much younger age. Example, wanting to be bottle fed like a newborn sibling. Projection, attributing that which is unacceptable in oneself onto another. Example, accusing a person of another race of being prejudiced. Somatization, manifesting emotional stress through a physical disorder, such as developing diarrhea that conveniently excuses one from going to work. Compensation, excelling at something to make up for a weakness of another kind, such as becoming a motivational speaker, although physically handicapped. Sublimation, channeling one's energies into an acceptable alternative. Example, turning to sportcasting when an athletic career is not realistic. Reaction formation, acting just the opposite of one's feelings, such as being extremely nice to someone who is intensely disliked. Identification, taking on the characteristics of another, such as imitating the style of dress, speech, or behavior of another person. Stress-related disorders are diseases that result from prolonged stimulation of the autonomic nervous and endocrine systems. Many stress-related diseases involve allergic, inflammatory, or altered immune responses. They are characterized by physical conditions that cycle through asymptomatic periods, which is absence of the disorder, to episodes that usually develop when the person is under stress. The brain-immune connection suggests that changes in body chemistry during periods of stress may trigger the following. 1. An autoimmune, self-attacking response, like those associated with rheumatoid arthritis and other connective tissue disorders. 2. Failure to respond, as in immunosuppression. Or 3. A weakened immune response, which may contribute to infections and cancer. Even psychological variables such as prolonged anger, feelings of helplessness, and worry can potentially influence the onset and progression of immune system-mediated diseases. Stress-related disorders: hypertension, headaches, gastritis, asthma, rheumatoid arthritis, skin disorders, hyper or insulinism, hyper or hypothyroidism, bruxism, which is teeth grinding, depressive disorders, cancer, low back pain, irritable bowel syndrome, allergies, anxiety disorders, infertility, and erectile dysfunction. Nursing implications. Nurses must be aware of potential stressors affecting, again, caring for stressed clients, continued, promote clients' physiologic adaptive responses, support clients' psychological coping strategies, assist in maintenance of social support, and implementation, stress reduction, and management techniques. Assessment of stressors. Holmes and Rahe, R-A-H-E, in 1967 developed the Social Readjustment Rating Scale, a tool used to predict a person's potential for developing a stress-related disorder. The rating scale is based on the number and significance of social stressors a person has experienced within the previous 6 months. The risk for a stress-related disorder increases as the person's score rises. Although the dollar amount in the mortgage-related item of the scale is outdated, being in debt is still a major stressor. Therefore, with minor modifications, the assessment tool continues to have diagnostic value. One research study ranked hospital stressors clients experience in a list modeled after the Social Readjustment Rating Scale. By being aware of how an illness or interactions with healthcare providers and facilities can affect clients, nurses can be instrumental in supporting those who are especially vulnerable. Prevention of stressors. By offering appropriate interventions to people with severe or accumulated stressors, nurses can help prevent or minimize stress-related illness. Prevention takes place at 3 levels. Primary prevention involves eliminating the potential for illness before it occurs. An example is teaching principles of nutrition and methods to maintain normal weight and blood pressure to adolescents. Secondary prevention includes screening for risk factors and providing a means for early diagnosis of disease. An example is regularly measuring the blood pressure of a client with a family history of hypertension. Tertiary prevention minimizes the consequences of a disorder through aggressive rehabilitation or appropriate management of the disease. An example is frequently turning, positioning, and exercising a client who's had a stroke to help restore functional ability. Stress reduction techniques are methods that promote physiologic comfort and emotional well-being. Some general interventions appropriate during the care of any client include providing adequate explanations in understandable language, keeping the client and family informed, demonstrating confidence and expertise when providing nursing care, remaining calm during crisis, being available to the client, responding promptly to the client's signal for assistance, encouraging family interaction, advocating on behalf of the client, and referring the client and family to organizations or people who provide post-discharge assistance. When caring for older adults, it is imperative to strengthen their social support resources as an intervention for reducing stress. It is also important to teach caregivers about stress reduction techniques. Reviewing again, be available to the client for stress reduction, respond promptly to the client's signal for assistance, encourage family interaction, advocate on behalf of the client, and refer the client and family to organizations or people who provide post-discharge assistance. Stress management techniques. People susceptible to intense stressors or those likely to experience stressors over a long period may benefit from additional stress management approaches. Stress management techniques are therapeutic activities used to reestablish balance between the sympathetic and parasympathetic nervous systems. Techniques that counter sympathetic stimulation have a calming effect. Stimulating tactics counterbalance parasympathetic dominance. Interventions that cause the release of endorphins, manipulation of sensory stimuli, and adaptive activities also mediate physical and emotional responses to stress. Nurses help clients manage stress, for example, by teaching principles of time management and assertiveness techniques. Endorphins are natural body chemicals that produce effects similar to those of opioid drugs such as morphine. In addition to decreasing pain, these chemicals promote a sense of pleasantness, tranquility, and well-being. Endorphins are produced in the pituitary gland, but are present in the blood and other tissues. Some believe that certain activities, such as massage, sustained aerobic exercise, and laughter, trigger the release of endorphins. Once released, endorphins attach themselves to receptor sites in the brain, perhaps in the limbic system, the center where emotions are experienced. Sensory manipulation involves altering moods, feelings, and physiologic responses by stimulating pleasure centers in the brain using sensory stimuli. Research is being conducted on the stress-reducing effects of certain colors, full-spectrum lighting in the home and workplace, music, and specific aromas that conjure pleasant associations, such as the smell of baking bread. Adaptive activities. To enhance adaptation, people experiencing stress may adopt techniques from the following categories: alternative thinking, alternative behaviors, and alternative lifestyles. Alternative thinking techniques are those that facilitate a change in a person's perceptions from negative to positive. Reframing helps a person to analyze a stressful situation from various perspectives and to ultimately conclude that the situation is not as bad as it once seemed. For instance, instead of dwelling on the negative consequences of a minor car accident, such as the expense and inconvenience of repairs, the person can choose to focus on the positive aspect of being physically unharmed in the accident. Alternative behavior techniques are those actions that modify stress in order to take control rather than become immobilized. Making choices and pursuing actions promote self-confidence over feeling victimized. Procrastination only prolongs and intensifies the original stressor. In addition, sharing frustrations with others who are both objective and supportive is more therapeutic than brooding in isolation. Other behavioral approaches to reduce stress include prioritizing what needs to be accomplished and initially attending to that which is most important or difficult. Less important activities may be postponed or delegated to others. And although other positive behaviors can be cultivated, it is also important sometimes to say no to avoid becoming overwhelmed and more stressed. Alternative lifestyle techniques. Alternative lifestyle techniques are those activities in which people who are prone to stress make a conscious effort to change their patterns of living. Some examples include improving their diet, becoming more physically active, cultivating humor, taking scheduled breaks throughout the day for leisure, power naps, or listening to uplifting music. Although pet ownership is not possible for everyone, those who do have pets find it soothing and relaxing to stroke and touch an animal that responds affectionately, regardless of a person's age, physical characteristics, or accomplishments. Pets seem to improve a person's feelings of self-worth in a way that extends to human relationships as well. This is the end of the slideshow.